Hello, I'm Janet Thew, and I am doing Medicare workshops because I want you to understand Medicare. I have learned over the last 15 and a half years that there's a lot of misinformation about Medicare. I have people that have been on Medicare for 10 and 20 years that haven't a clue what Medicare is and what kind of insurance they have. So I know I asked you to bring your questions tonight, and I want you to put your questions aside right now, clear your minds, and when you walk out this door, you will understand original Medicare and what your choices are. That's my goal tonight. So clear your minds, and we're going to begin. Medicare made easy. First of all, this chart is simply showing that there's a lot of misinformation, as I was saying, about Medicare. Out of the 50% who want information on Medicare, 12% are getting information. What Medicare is. Medicare, original Medicare, is Part A, hospital, and Part B, medical. Not Part C, not Part D. Original Medicare is Part A and Part B. Part A, hospital. Part A, hospital is the facility of the hospital. The staff of the hospital, the food in the hospital, the rooms in the hospital. What happens in the hospital, the doctor, the operation, that is not part of Part A. Part A is simply the facility of the hospital. With original Medicare, you get 60 days in the hospital with a deductible. And that deductible goes up every year. 60 days for any occurrence, each occurrence of, so if you have an appendectomy, that's one occurrence, you have 60 days in the hospital for that. If you need to go back in because of some other procedure, a different procedure, that's an additional 60 days with an additional deductible. If you have the same occurrence, something that goes wrong, and you go back into the hospital, they start counting from the day you left off and continuing through those 60 days. Also, original Medicare Part A is home health care, which is rehab. You have 20 days of rehab, 20 days of either home health care or rehab after your operation. That is also included in Part A at no additional charge. And you also have hospice. Everybody on Medicare Part A has hospice for free. If you pay into Social Security for a minimum of 10 years or 40 quarters, you get Part A for zero, nothing. You pay nothing for Part A. So everyone should sign up for Part A when they turn 65 or when they become eligible for Medicare, even if they continue working. Except if you have an HSA account. If you have an HSA account, you can no longer contribute to it on Part A Medicare. But other than that, when you turn 65, if you want to continue working and you were insured through your company, you still want to sign up for Part A. As I said, it's free and it works with your insurance. It becomes secondary. Your work insurance is primary as long as you're working. Are there any questions on Part A? If there are no questions, I'll continue. This is just a chart that shows how the first 60 days of a hospital are paid and how the first 20 days of rehab are paid. They are paid, and additional days cost money. Then there is Part B. Part B of original Medicare is the part that you have to pay for. This year it's $121.32. Last year it was $104.90. So it jumped substantially between last year and this year. Part B medical is all medical. Everything except the hospital and the rehab. Part B is chemo, radiation, your doctor, your operation, your anesthesiologist, crutches, wheelchairs, all of that is Part B. Part B covers 80%. 80% of all your medical bills are covered by Part B. So now you have hospital, rehab, hospice, and you have all 80% of your medical. The problem with Original Medicare, and the reason you're all here tonight, is because there is no maximum out of your pocket for the 20%. So if your operation costs $1 million, you'd owe 20% of that. If you needed to go back into the hospital, more medical treatment, you'd owe 20% of that with no maximum. Also Part B, there is a penalty if you do not sign up for Part B when you're eligible. So when you turn 65, if you are retired and you are not getting insurance through your work or your spouse's work, you must sign up for Part B or there is a penalty. That penalty is 10% of the cost of Part B. So that in other words, that would be 10% of $121.32. So consequently, you need to sign up for Part B if you are not working. Now, as I said before, the problems with Original Medicare, there is no maximum out of your pocket. That's huge. We could lose the farm on that. There is also no prescription coverage under Original Medicare. There is no foreign travel. Original Medicare is simply the United States. No dental, vision, hearing, fitness. Those things are ancillary. They are not going to cause you to lose the farm, but they are important too. So we have ways to solve these problems. This is the part that everybody gets confused. You can add a Medicare Supplement, which will pay the other 20%, or you can leave Original Medicare and join an Advantage plan. An Advantage plan pays instead of Original Medicare. It encompasses Parts A and Parts B, hospital and medical. And it can also add Part D, which is prescription coverage at no additional charge. So consequently, Advantage plans are all-encompassing Parts A, B, and D all rolled into one. The big problem that everybody has with Medicare is that they get confused what is a supplement and what is an Advantage plan. Then also, if you qualify for Medicaid, Medicaid pays where Original Medicare leaves off, or you can join an Advantage plan, and that would pay instead of Original Medicare, and then Medicaid would pay where the Advantage plan left off. This is a chart showing what a Medicare supplement is. This chart is not exactly accurate, so let me tell you. If you have a supplement, supplements pay when Medicare pays. As I said before, Original Medicare pays that 80% of Part B. The supplement virtually pays the other 20%. Now, some of the plans pay a little bit more or a little bit less. But with a supplement, you basically have nearly 100% coverage because it's going to give you additional days in the hospital. Most of the plans will pay for that deductible in the hospital. Some of them don't, so you need to look at that. So when you decide on a supplement instead of an Advantage plan, we go into what each one of these plans are in detail and then the cost. But what you need to know is that whether you have an F plan from ABC company or an F plan from XYZ company, it's an F plan. They're a government program, consequently, the F plan is exactly the same regardless of the company. So what we care about is which plan and how much does it cost? What is the premium? Because some companies are going to charge you more than other companies for the same plan, because it depends on how many people they have in that plan and how many people are sick in that plan. They have to make a living, so they have to raise the price if they don't cover their costs. But virtually what I want you to know tonight is that a supplement works with Medicare. It pays when original Medicare leaves off. It pays virtually the other 20%, and it also has, as you see here, foreign travel. Most of the plans have foreign travel. Some of them do not. That is a $250 deductible, and then it pays 80%. So if you get sick, get taken care of, and then come home. The other choice that we have, other than with original Medicare, the supplement is one. The other one is a Medicare Advantage plan. As I said before, a Medicare Advantage plan encompasses original Medicare Part A, hospital, original Medicare Part B, medical, and it can also include Part D prescription plan at no additional charge. These are examples of different kinds of Advantage plans. HMOs are the most common. You have to be in network. You have to get a referral from your primary care physician. An HMO point of service means there is a network, but you can go out of that network. Point of service means, a POS means point of service. A PPO is a primary provider. You do not need a referral on an HMO point of service, a PPO, or a private fee-for-service. You do need a referral with an HMO. The disadvantages of a Medicare Advantage plan is it can limit you, especially with an HMO, to the doctors that you see. With original Medicare and a supplement, it's any hospital in the entire United States, no referral necessary. With an Advantage plan, remember the HMOs, you have to get a referral from your primary care physician. Your primary care physician has to be in your network. You can go out of network, but you have a network. So consequently, it can be limiting in whom you see for your medical care. You might pay higher prices if you need to go out of network, and it may not always cover certain things that are necessary. The advantage is it's much cheaper, typically, than a supplement. If you are virtually healthy, if you don't go to the doctor a great deal, if you stay out of the hospital, you can go to the hospital with some things. You still will be better off with an Advantage plan because it's much lower premiums, and we can have zero premium plans that include prescriptions. So a lot of people love Advantage plans because they don't go to the hospital that often. They don't see the doctor. You do, with all of these, you get a free physical and you get preventative covered. But if you end up in the hospital, you might see a higher bill than if you were on a supplement. Okay, so the advantages of a Medicare Advantage plan are actually many. Advantage plans are wonderful things. Advantage plans can include prescriptions at no additional charge. They can include dental, fitness, all sorts of other things at no additional charge. And you pay a lot less for them. The premium can be zero, or it can be $19 or $24. It's a lot cheaper than a supplement. However, remember that if you do end up going to the hospital, you might end up paying more than you would within a supplement. But most people enjoy Advantage plans because if you have outpatient surgery, for instance, it's usually around $450. Remember, Medicare rates are much lower than before you're on Medicare. So cataract surgery before Medicare is about $2,000 per eye. On Medicare, it's more around $250 per eye. So it's a much cheaper to be on Medicare. So now we are to Part D, prescription coverage. Part D, prescription coverage, if you remember, it's still a federal government program. All of Medicare is a federal government program. Consequently, the federal government tells the insurance companies how they're going to deal with the prescription coverage. All prescriptions must have at least, all prescription plans must have at least 2 drugs in every area of need. So if your prescription is not on the formulary, and if your doctor will not allow the drugs on the formulary to be the ones you take, there's a 90-day window in which they can find a prescription on the formulary that fits, or your doctor must write an acceptable exception of why you cannot take the drugs on the formulary, and then they must cover the drugs as if they were on the formulary at the same rate. So if it's a brand name, it would be covered as a brand name. If it's a generic, it would be covered as a generic. So during the middle of the year, you might have drug change, and you worry that now your company is not going to accept it. That's not going to be an issue. They will try to find for generics most of the time if you can take them to save you money and to save them money. You have all heard about the Part D gap and the Part D penalty. The Part D gap is the time of year when you have reached $3,310. It was $2,800 last year. This is not just the amount you paid for your prescriptions. It is the combined amount that you have paid for your prescriptions and the company, the insurance company, has paid for your prescriptions. In other words, let's say you take a generic, and the generic is $0 copay for you. But the insurance company might be paying $40 a month for that. So they add that $40 with your $0, and each month they add that together, and when the combination of what you pay and they pay together equals the $3,310, then you fall into the gap, and you will pay substantially higher for those prescriptions until you reach $4,850, and then your prescriptions go down to only 5%. Now, this is a welcoming thing for people that have very, very expensive drugs. They want to hit the gap because they are paying $4,000 a month for their prescriptions. They can't wait to hit the gap because once they hit it, they get to pay only 5% of that cost. The rest of us, we don't want to hit the gap. We want to have our $0 premium copay generics, $0 copay all year long. So consequently, we do not want to hit the gap. And there is an additional slide, something in your workbook that shows exactly what you will pay. So we're not going to go over that right now. The next thing is the Part D penalty. There is a penalty if you do not have credible prescriptions coverage. So consequently, if you continue working, for instance, after the age of 65, and your employer covers you, you must check to make sure that that insurance that you are on has credible prescription coverage. If it does not, you need to join Part A, and with just Part A, you don't have to have Part B, you can have a prescription plan. And that prescription plan will then cover your prescriptions along with whatever your company benefit is. If you are not employed, do not have insurance, of course you have to sign up for Part D or else you have a penalty. Now they don't make you sign up for Part D, so if you say, I don't take any prescriptions and I don't want to sign up for Part D, later on you want to, there's going to be a 1% of the average cost of a prescription plan, which right now is around $33, $34. So your penalty would be 1% per month of that. So in other words, 33 or 34 cents a month for each month that you do not have that prescription plan. I have a lady in her 80s who never had a prescription plan, and now her prescriptions are extremely pricey. So she now has to pay that penalty. Her penalty is around $15 a month. But it's well worth it for her because her prescriptions were very expensive. So she pays that $15 a month in addition to her prescription plan charge for the rest of her life. That's how it works. So 1% per month for every month that you're not on a prescription plan. The reason for that, it's actually not a bad thing, it's a good thing. Because if only those people taking a great deal of prescriptions or very expensive prescriptions signed up for a prescription plan, and everybody that didn't take prescriptions didn't sign up for a prescription plan, the cost would be prohibitive. Consequently, they're able to share the cost. There are 48 million people on Medicare right now, and they can share the cost by having everybody sign up for that plan. And remember, with an Advantage plan, you're not taking any prescriptions, you're probably going to be an Advantage plan. The prescription coverage is zero. It's added to that Advantage plan at no additional charge. So now you have a prescription plan, you don't take any prescriptions, you're happy. So that is another advantage to an Advantage plan. Here is the diagram that shows if you are in a higher income bracket, you're going to have to pay a little bit more for your prescription coverage. And this diagram is simply showing you what that would be. The final thing today is to tell you about me. The federal government actually tells us that we need to tell you how we are compensated. You pay nothing for our service. The insurance company gives us a commission for every person we enroll into their plan. You do not pay more for that coverage whether you have us, an agent, helping you, or you just sign up online. And everybody in here can sign up online, but you do not get the expertise that might be needed. So an insurance agent basically works for you for free. We want you to choose the right plan. We want you to make sure that you know every year you can change plans. Every year you sign up for a prescription plan from January 1st to December 31st. You also sign up for an Advantage plan January 1st. A prescription plan and an Advantage plan are January 1st to December 31st. Consequently, we have annual enrollment period. That is a period right now between October 15th and December 7th, at which time you can change plans or stay with the same plan. You can also go back to original Medicare and get a supplement and go out of that Advantage plan. Everyone can do that every year. There is one exception. A supplement may ask you, is there something that a medical professional has advised you to do that has not been done yet? They can ask you that question, and if you answer yes, you will not be able to go back to a supplement until you have that done. An example is I have a client named Paulette. Paulette has been on an Advantage plan ever since they came into being in 2006. She's had a zero premium plan. She is a very healthy gal. She's now in her 90s, and she called me last October and she said, Janet, I need a heart operation. I need to get to a supplement. And I said, no, Paulette, you can't get to a supplement because they're going to ask you, is there anything that the doctors recommended you do that hasn't been done? And that's definitely something that hasn't been done. Now remember, if you might need knee replacement or hip replacement, but it's a suggestion. You can do it this year, next year, or the year after. That's not the same thing. This is something that you need to be done that has not been done. So she needed to have the operation, so she needed to stay into her Advantage plan. However, her operation was not going to occur until February, and this was annual enrollment period in October. So I was able to change her Advantage plan. I put her in the Advantage plan that had the least maximum out of pocket. She was in a plan that had $6,700 maximum out of pocket. I put her in a plan that was $4,200 maximum, saved her $2,500. She then went and had her operation. She was in intensive care. She did hit her maximum. However, after her operation, she told me she wanted to go right back to an Advantage plan, which you can do after the operation is over, has been accomplished. So that's one of the things insurance agents do. We can help you select a plan, make sure you're in the right plan, check on your prescriptions every year. They change, you change, the insurance company changes, the plan changes. One year it might have fitness and dental, the next year it might not. So we can advise on that. We also help with billing problems during the year. So if you get a bill, my copay was supposed to be $5, why do I have this bill for $75? This is something else that we help you with. I also have every year an annual client appreciation event, and I have that event in September. I do that in September because your annual enrollment is October 15th. I remind you, I have fun at the client appreciation event. We have a good time. But I remind you, come see me. Even if you're on a supplement with prescription coverage, I want you to come and see me. I had one couple whom I've known for 20 years, and they said, we're on a supplement, we don't need to come and see you. I said, yes you do, you have a prescription plan. And your supplement price might go up, the premium. Now remember, you can change supplements anytime during the year. A supplement, January, February, March, it's not year to year. It's month to month, and it's statewide. So you can change that supplement. Maybe your premium is way too high, and you haven't checked it in 5 years. The prescription plan, maybe your prescriptions have changed. Maybe the plan no longer covers as well. You don't know that. Come and see me. So this is another thing that we do to make sure that you are where you need to be. That concludes my presentation. Are there any questions?